This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Your kidneys are keys to your survival.
It maintains the homeostasis. When you say homeostasis, the balance of our body as to water, regulation, clearing off dirt in our body, we call it the creatinine, and also it produces some hormones for the redness of our blood and also for growth.
But if you don't take care of it, you will be at risk of developing kidney diseases.
Chronic kidney disease is a state wherein the kidney fails in every aspect of its function, meaning the kidney cannot filter anymore the dirt, water that it takes in, or the fluids that it takes in, so it fails.
According to the National Kidney and Transplant Institute, kidney diseases, especially end-stage renal disease, is the country's 7th leading cause of death. In fact, 23,000 Filipinos underwent expensive dialysis due to kidney failure in 2013, based on data gathered from the Department of Health.
Dialysis is actually a process wherein there's a kidney functioning out of our body, which will clear off or give the function of a kidney that is in our body. It could be done in two ways. By the peritoneum, we call it the PD or peritoneal dialysis, or we can do it through a machine, we call it hemodialysis.
Unhealthy eating, inadequate sleep, and a lethargic lifestyle are major factors that can cause hypertension and diabetes, which in turn result in kidney disease. You should be extra attentive in taking care of your kidneys since the cost of treating kidney diseases is usually beyond the reach of ordinary Filipinos. There is also a shortage of kidney donors, so it's a must that you supply yourself with the right knowledge and strategies in your fight against these kidney diseases. What are the signs that your kidneys are failing you? What are the best treatment plans available? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Violet Valderrama, the overall chairman of the National Kidney Month Committee and a pediatric nephrologist from the National Kidney and Transplant Institute. Also joining us is Dr. Elizabeth Montemayor, an adult nephrologist. She is also the head of the renal section of the Manila Doctors Hospital and the chair department of physiology of the UP College of Medicine. You may join our discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening, Angel.
It's National Kidney Month.
Yes.
And on the show, we're going to understand more about our kidneys, how to take good care of it, and the functions of our kidneys. So why are our kidneys important? Why do we need them?
So basically, we have two kidneys. So there's always saying that you can share one and you can take care for one, but you can live with one kidney as long as it is healthy. So it is at the back, located at the back. So it's behind our stomach, our liver, and it's about a fist-like size. So in adults, it's about 150 grams. Upon birth, mga 24 grams lang yan. And by length, mga 24 centimeters. So the function of our kidneys, as I've said earlier, is to filter out the dirt in our body. It also balances the water that we take in. It concentrates it. It filters the dirt. And also, it has function in production of our hormone that is responsible for the redness of our blood together with the bone marrow. It also has a function in the balance of the acid base, wherein it will have to have a healthy environment for the function of our kidney.
Yeah. Aside from the function of the kidney as a regulator of the excretor of waste products and regulator of all the fluids and electrolytes, the kidney actually is a very important endocrine organ because it secretes at least it produces at least 3 very important hormones. One hormone is responsible for the production of the red cells, and therefore you will see most patients with kidney problems who are very anemic. So pallor is a very prominent manifestation of kidney problem or kidney disease. The other hormone that the kidney produces is the active form of vitamin D. So patients with kidney problems will have bone diseases.
Yes.
And also, it's very important in the regulation of blood pressure because, again, it secretes a very important hormone or enzyme called renin, and this is very important in the regulation of blood pressure. And we would say, as nephrologists, that the kidneys really reign supreme in the control of blood pressure.
So it's the kidneys that you mentioned
Yeah.
reign supreme.
Yeah.
But why do people take it for granted? Is it because it's at the back and we don't see it, or it doesn't really tell us that it's there?
Yeah, the kidneys are really very silent workers. So it works for us every minute of every second of the day. And unlike the heart, where you can feel the heartbeat and get the blood pressure, the only way by which people will notice that the kidneys are important is when they produce the urine and they have to go to the toilet because there's this urgency to remove the content of the bladder. But other than that, the kidneys really are very silent.
And basically because maybe the signs and symptoms, we don't see it very early in the
Yes.
disease. As Dr. said, it's very silent. It's only upon the time that you will see visually, like in children, the moment they see it's red urine, that's the only time they will seek consult. But behind it, there are already signs and subtle signs and symptoms initially.
But the most important sign and symptom that there is something wrong with your kidneys is the urine in adults and in children. Is that
Not
correct?
really the urine, because the urine is just being produced. The signs and symptoms, because the urine is already a
Yes.
product of the function of what the kidney has to do. So most of the times when the kidneys are failing, you're not going to feel anything. Sometimes there are subtle signs, like if you develop edema, himanas, ganon. If you pass out tea-colored urine.
Yes.
And for the young, hypertension is a very important manifestation of a possible kidney problem.
Yes.
Even in the young
Yeah.
these
Yeah,
days,
for the
doctor?
young, if the patient, if somebody is hypertensive at a very young age, children,
Yes.
teenagers, young adults, you have to investigate the kidneys.
Further. It
Yeah.
could be secondarily because of the kidney.
It could be, could it also be the habits that we've formed through the years, or it has been passed to us by our parents, like a certain lifestyle that has been passed to us that affects our kidneys, like the stress
Yeah.
or eating
Yeah.
habits, or,
Yes, yes, yes.
or the environment.
Yeah, that's true.
Yes, yes. Sometimes you say that the kidney problem is mana-mana, no? But
Oo.
actually, it's not really the kidney disease that is mana-mana, but the habit, the lifestyle. So if you belong to a family where the diet is high in salt. Yeah, or a family
Which
where...
raises the blood pressure sometimes.
Which
Kung
raises the
mataas
blood.
ang,
Yeah.
ang BP, no?
Kaya nga ang sabi, you are what your mother eat.
Okay.
And
So you
what your
refer
lola
to
eat.
what you have on the table,
Yeah.
what
Yeah.
has been
It
served
is a
to you as
habit
your
or
family.
what is really in the table that you eat.
You were mentioning, Doctor, sodium, no, the food that we eat. What other
Yes.
factors contribute to our kidneys showing signs and symptoms that it's failing?
Sometimes, when you present with symptoms, it's already a very, it's a very serious disease already. So the first, if you have the risk factors, you have to be already on the guard. And what are these risk factors? Hypertension, diabetes, smoking. Smoking is a very important risk factor for kidney diseases. If you have a family history of kidney diseases, you may develop, because there are many certain kidney diseases which can be passed on to the children.
How about the habit of not drinking enough water? I mean, this holds
Yeah.
true for
Yes,
adults and
yes,
for
correct.
children.
It's
as well.
true,
That's correct.
because nowadays, children are already being given water, carbonated drinks, The lifestyle that we have, that iced tea, and even the sports drinks, we treat this as water already, as hydration, but it should not be the case. And we eat a lot of salt. Filipinos basically eat anywhere from 5 grams to 7 grams.
Mataas ang timpla ng Pinoy when it comes to salt. When it comes to
So
putting salt
it's
in
way
it.
beyond what is really required of us. So it's really and the lifestyle is different. They're more sedentary than the usual that we play outside.
Yes. How about sleep and stress?
Yeah, sleep and stress can indirectly lead to kidney diseases because they can lead to hypertension. And when you're stressed, sometimes you have other habits that accompany the stress, like people who are stressed,
They drink.
smoke, drink,
Yes.
They eat.
yeah, eat. So there are other factors which may contribute indirectly to the development of kidney diseases.
As nephrologists, no, what is the difference between your practice and the urologist when in terms of taking care of the kidneys before we go to a break?
The nephrologists are the medical people. So the urologists are the surgeons. So the urologists, they have to have a training first in surgery before they become urologists. For us nephrologists, I have to finish training in internal medicine before I subspecialize into nephrology. And the pediatric nephrologist will have to have pediatric training before taking up a subspecialty.
It's important to know these things. So when you
Yeah.
seek a medical advice, you know exactly where to go. No?
Yes, yes.
And the kind of treatment that should be given to you by the medical doctor that you run to. In this case, for
Yes,
kidneys, a
yes,
nephrologist,
yes.
no doctor. We'll talk more about kidney diseases, the signs and symptoms, and other factors that contribute to kidney failure when MedTalk returns.
Did you know that some people can live a near normal life with only 20% of their kidney functioning?
We're back here on MedTalk, still talking about kidney diseases. This time, doctors, we have a caller on the line. Good evening, Lorna Monsato.
Yes, ma'am.
Hi, good evening. Yung question mo for our
Yes,
doctors?
Good evening, ma'am. Yes,
Good
yes,
evening.
tanong lang po sana ako.
Sige, please go ahead.
Yes, kasi sa giliran ko, ma'am, every morning, pagising ko, ang sakit-sakit sa gilid. Tapos, minsan, vitamin ko bumabalik sa CR. Ano po yun, ma'am? Sign po ba yun ng kidney problem?
Which area of...
So masakit daw sa gilid.
Gilid.
Tapos may frequency, ma'am, and urgency.
Yeah.
Okay.
Kasi marami pa tong mga follow-up questions eh. Halimbawa, kailan yon pagising mo ba sa umaga lang ito? Tapos nawawala yung pains pagka tumatagal na ang araw?
Yes, ma'am. Wala naman po siya. Pagising ko lang sa umaga, ang sakit-sakit sa tagiliran.
Oo. Kasi kung halimbawa ito'y dahil sa kidneys, usually it's not related to time, no? So if there's pain all throughout. Pero minsan dinidescribe yung pain ng mga kidney problems as colicky, yung bigla ang masakit, tapos medyo mawawala. Or kung maski ando dun man, konti lang, tapos bigla na namang hihilab, parang ganun, colicky type of pain. Ibig sabihin nun, parang merong mga bato or nagbabara dun sa daanan ng ihi, and the kidneys are really trying to push down this obstruction. Pero hindi din nangangahulugan na pagka ganun lang ang klase ng pain, kasi pagka matagal na ang nakabara, parang wala ng symptom. Ang pangkaraniwang cause ng pain paggising sa umaga, usually mga musculoskeletal pains yan, no? Lalo na sa mga above 50s kasi syempre nagkakaroon na konti tayo ng rayuma. So, that's characteristic of arthritic pains na masakit pagising pero pagka tumayo na, kumilos-kilos na, medyo nawawala na.
Okay. Pero 5 times po ako, ma'am, bumabalik sa CR. Ano po yun, ma'am?
Depende. Usually, pagka may urinary tract infection, madalas pumupunta sa banyo. Isang manifestation yon ng infection sa pantog. Pero halimbawa, kung ikaw inom ng tubig, ihi ka din ng ihi. So, punta ka na din ng punta sa banyo. At pangkaraniwan kasi sa mga kababayan natin, parang paggising, parang naging nakagawian na uminom ng 2, 3, 4 na basong tubig. So kung anong pinapasok mo sa katawan na hindi kailangan ng katawan, mapipick up agad ng kidneys niyan eh. You know that the kidneys are really very intelligent organs. Anything that is in excess, like you take sodium, and that is not needed, the kidneys will remove
Immediately.
this. Yes. And the water, you can see that if you drink a lot of water, in just a few minutes, you have this urge to void. No? So, napakatalino po ng kidneys natin. Nasisense agad niya yung mga hindi kailangan sa katawan.
Okay. Po.
Okay, salamat, Lorna.
Yes, ma'am.
So the kidney is very intelligent. It can sense what we need and what we don't need.
Anything that is in excess.
Really, even water.
Yes, even water.
Which from the discussion earlier, which we need a lot to keep our kidneys moisturized, so to speak.
But your body needs only this fixed amount of water. So if you have this fixed amount of water, what goes in should go out. So the salt that goes in should go out.
And whatever is needed is retained.
Yes.
And whatever is needed is retained.
And sometimes what is retained is not exactly what we need. Therefore, it causes our kidneys to fail. And so what are the 2 kinds of kidney failure? Dr. Mandimar, let's start with you.
There are really actually 2 kinds of kidney failure. One we call acute kidney injury. This usually means that your kidneys were functioning fairly well or were normal before, but within 3 months there is this sudden deterioration of kidney function. And usually it can be caused by certain toxic substances, or dehydration, like if you have severe diarrhea and you become dehydrated. Or if you have, for example, cardiac failure and the heart is no longer perfusing the kidneys well. So you can have acute kidney injury. Sometimes you will require dialysis, but the thing with acute kidney injury is there's this potential for reversibility, that your kidneys can go back to its previous function. The other kind of kidney failure is called chronic kidney disease, and this is the type of kidney disease where the kidneys gradually fail. And so the concept there is that if you go to end-stage kidney disease, and we say end-stage kidney disease, this is irreversible.
Because it has lost all function.
Yeah, because it has lost the function, yes.
Is it the same with children,
Yeah, it's
doctor?
actually the same. The most common cause of which for acute kidney injury is dehydration in children, because alam mo naman, mga nanay, hindi dadaling kagad sa ospital, tubig lang ang bibigay. But yung hydration, no, kailangan may mga asin na ilalagay ka, no? Tapos, kasabay nun, may mga sakit na ang sakit sa bato, kidneys kagad ang ating inaapektuhan. So we call that mga glomerulonephritis, because we are a third world country and basically it is an infectious country. We have a lot of tonsillitis, and then we have also skin lesions, which are also a precedent occasions before we have this glomerulonephritis. So meron ding mga causes na UTI lang sa bata, no? It's just the tip of the iceberg. Parang yun lang ang tinitreat palagi. Yung pala, nagkaroon na ng permanent effect sa kidneys mo. So in children, it's different in a way that in adults, yung mga chronic kidney disease nila, it's more of
Diabetes
diabetes,
or
hypertension.
hypertension, yes.
Sa amin may mga congenital problems na sinasabi at saka yung glomerulonephritis na. Yun.
So the chronic and acute, well, as mentioned, the chronic, your
Chronic
kidneys
Matagal.
Oo.
But
Unti-unti kasing nasisira yung kidneys doon eh.
will your kidneys go back to its normal function like the acute case?
No, not anymore.
Kasi scarred na yun eh.
Scarred na siya.
Scarred. oo.
And you need treatment and,
Yeah.
and
Yes.
more intensive care for your
Yes.
kidneys in that case.
Kasi we have filters in our kidneys, we call it the nephron, ma'am, di ba? So, the nephron are fixed number when we are born. There are about 1 million in each kidney. So, this nephron, by natural aging, they scar. But if there is a disease or an illness, it will add on to the scarring if not controlled.
So parang
Yes, and
go
the
ahead.
reason why we say that kidney disease is actually very progressive. So initially you start with, let's say, 1 million cells in the functioning kidney cells. So 50% of that gets destroyed. So you just have 500. So these 500 cells will take over the function of the others. So they work double. And so parang kagaya nung nagtatrabaho sa pabrika, di ba? You know, if you have 100 workers and now you remove the 50 and 50, workers will do the function
Yes.
of the 100, then madaming magkakasakit dyan. So, eventually, marami magiging absent. So, 25 na lang gagawa ng function of the 100. So, mas marami ngayon, mas malaki ngayon ang burden sa kanila. No? And that's why it gets progressive and as more kidney cells fail, then the remaining nephrons now will have to work harder.
Yeah. Kasi shared function eh. Ang kidneys mo talaga.
How about in polycystic kidney disease? What happens to our kidneys? What type of function does it lose when it has this kind of disease?
Yung polycystic kidneys kasi, it's an autosomal dominant.
What does that mean?
Yung manamanang sakit ito, where the kidneys become cystic. So kung halimbawa, yung nagiging cystic siya, and it's a dominant trait. So like if I have this trait, 50% immediately of my
Yes,
offspring
offsprings
will have the disease. So what happens that the disease become big, and so as they become big, then they compress the normal tissues. No? So parang nawawala na yung normal na tissue ng kidneys.
Pero
When you
there's
say-
another
go
type,
ahead,
yung
yes.
recessive trait, which is more common in children. Though this, may mga kasama ring, pwede kasing mag-cyst din ng liver, di ba ma'am? Brain, etc. So, it's not actually a cancer. Cyst is
Okay, because
forming.
I was about to ask, when you say cyst, ang common notion
No.
cyst siya, so equals a cancer cell.
No.
Pero
Pero
hindi
may,
pala.
may mutation na nangyayari sa genes mo. So itong mga recessive naman na type of polycystic kidney, they don't get old. So namamatay talaga sila because may mga kasamang lung hypoplasia din, hindi nag-grow yung lung sila, etc. Yung nagiging adult, usually may mga dominant type. And nakikita lang minsan pag blood pressure, high blood na sila. And then you try to investigate, the doctors investigate, they see the ultrasound there are cysts.
Cysts. And inside those cysts are they
Fluid.
other
Yeah,
fluids.
fluids, yeah.
And do you how do you get rid of
You
those
don't
fluids?
remove.
You just
No,
they just kumbaga nagde-decompress na lang sila. Is that correct?
No,
Hindi rin.
they get bigger, and that's why if they become bigger, you have this surrounding normal kidney tissue, so nako-compression.
And that's what takes a toll on
Yeah.
masakit
Sometimes,
ba
you
yun?
know,
Do you feel
kasi
that?
like, lumalaki sila yung polycystic kidney.
But you don't feel that. You don't feel it sa likod.
Yung iba may flank pain, meron.
okay.
Tapos some would have red blood cells in the urine.
Okay, okay.
And then you get to check the urine, then you see really the red blood cells. What we only do is monitor it in time. So eventually, pag na-wear off na lahat, ma'am, they also end up to end stage.
Yeah.
You mentioned red blood cells. About hematuria, does it have
Yeah.
anything to do with the red blood cells inside our kidneys?
Yeah, hematuria means the presence of red blood cells in the kidney, and it's really an abnormal finding in the urine. So it can mean somewhere from the glomerular diseases, or stones, or tumors.
Yeah, even UTI. If your UTI is concentrated in the bladder, you can have red blood
So
cells.
automatic, when you have UTI, it's immediately connected to our kidneys. Or
Not
not
necessarily.
necessarily.
Kasi when you say UTI, then you have a lower urinary tract where it affects only the bladder and the urethra. So it does not affect that. It is the most symptomatic kasi pagka may UTI ka, di ba, yung may dysuria ka, binabalisaw. So it's really a very uncomfortable
Yes.
feeling. So, but it is usually a type that is the least serious of the kidney problems.
Okay, doctors will talk more about kidney diseases. There are some myths surrounding kidney diseases.
Yes.
We'll talk about that and more when MedTalk returns. We're back here on MedTalk, still talking about kidney diseases or kidney problems. Let's talk about the myths this time, doctor. Okay, so let's talk about the first myth of kidney diseases.
Okay.
Kung konti ang iniinom mo,
Kung
you're
konting
going-
iniinom mong tubig.
you're going to have kidney disease. That's not
Yes.
a myth. That's a fact because there are at least 4 diseases which are associated with very little water intake: urinary tract infections, stones. Sometimes it predisposes you to tumors. Yeah. And chronic kidney disease. So yung konting iniinom is
Okay.
it's not a myth.
That's not a myth.
Yes.
Okay.
Pag inom ng buko.
Yes.
Buko, di ba? They say if you have UTI, you keep drinking buko so mai-eliminate mo yung
buko.
infection. Is that true?
There are walang studies dyan.
Walang strong studies, and
dyan.
I think sa ngayon the evidence still that it's similar to water.
Yeah.
Okay.
To water.
Another myth, yung pag-isa ang kidney mo.
Yes. Here, kidney failure can occur if one kidney fails. Is that
You can live with one kidney, that's why, wag lang walang kidney, agenesis ang tawag doon. You can live a full life even if you have one kidney. Kasi nga, ang sabi nga, as earlier explained by Doktora, yung function ng kabila, it can be assumed by the other
other
one.
one? Yung 100 na
Yung 50, dadagdagan mo ng 50, magiging 100 siya, double time work. Though, mas kailangan ka mas mag-iingat lang kasi you have to take care of one kidney na lang, like in your diet. Hindi ko pwede ng contact sport na masyado, natatamaan yan.
Yes, yes.
So, the moment you have UTI, you should seek consult right away. Pag may hypertension, mas kailangan may check-up ka na mas maaga because we have to take care with that one kidney.
Okay. Well, we already mentioned the drinking a lot of water, no, doctor? So what are the other myths that you encounter in your practice? Parents complaining about their children and the myths that surround these complaints.
Actually, it's more of the food, that if you eat salty foods, that's true, as I've explained early on. Kasi we don't need a lot of salt in our body. And if it's in excess, it can form also stones.
Okay.
And it's a bad deal for our health.
Vitamins for the kidneys.
You mentioned that the kidney lack, for those who have kidney failure, vitamin D. Yung sa bones,
Yeah,
no,
sa
it
bones,
gets
yeah.
affected. So,
Pero yung the myth that there are vitamins for the kidneys, that's really a myth because there are really no vitamins for the kidneys. A healthy lifestyle is the most important. So if you take care of your blood pressure, if you control your diabetes, if you drink a lot of water, if you don't smoke, then these are the vitamins for the kidneys, but there are really no vitamins for the kidneys.
and this one's not a myth. It's a personal question because when we're tired, no, and we get a massage, our bodies here, banda sa kidneys. And I was asking Dr. William Matamaya earlier that when these kidneys are massaged, I say they're not affected naman, no? Because
they're not
you mentioned there's a
affected.
muscle, right?
Yes.
Right before the kidneys.
Wag lang sobra, ma'am. Yung mga rhabdomyolysis, yung, di ba yung mga hazing?
Yes.
Yeah, it can
yes.
cause kidney failure.
But massaging that particular
massaging,
area.
yes,
is
the
okay.
particular
Very
area
supple.
relaxes the muscles
Yes,
of the
yes.
back. So it has nothing to do with the kidneys.
Okay, all right. How about living donor organs are better than diseased organs? Organ donors for our
Organ
kidney.
donors,
Yes.
the deceased organs are a very good source of kidney donors. The only difference is that when you have a living donor, you can take your time, be relaxed in the scheduling of the kidney transplant.
Yes.
Whereas if you have a deceased donor, then anytime an organ becomes available, you really have to rush everything.
Yes.
Call the recipient, prepare the operating room, because you don't like to waste time. There's a golden period for the harvested kidney. So the longer this harvested kidney is not transferred to the recipient, then the greater the chance of the kidney not functioning early. So it is responsible for a delayed graft function.
We encourage here in the Philippines already organ donations.
Yes.
Though in the States and abroad, mas common kasi talaga ang deceased donor. Pero dito, mas malamang sa atin ang living donors.
Yes.
Related.
Yeah, we would like to encourage really the deceased donor kasi sayang yung organs, di ba? Sayang yung organs. For the living donor, actually, we really make sure that this donor is going to lead a very normal life. So, very extensive ang workup sa kanya to make sure that wala siyang problema. Remember that a living kidney donor is going to undergo a surgery that has no benefit at all whatsoever for him. No?
Yes.
Usually when we undergo surgery, di ba, we removed a deceased organ, yung ganon. A deceased appendix, a deceased gallbladder, but this living donor is going to undergo a surgery that has it's not going to
It's out of the
benefit.
goodness of one's heart
Yeah.
already, no?
And it's only that the kidney na pwede niyang
I-donate.
i-donate. Pwedeng mata, pwedeng liver. So, ang daming pwedeng matulungan pa niyang pasyente.
Doctors, we have another caller on the line. Good evening, Maribel Dayo.
Yes po.
Hi, magandang gabi. Please go ahead with
Magandang
your...
gabi po, Doktora.
Magandang gabi.
Oh, Doktora, tanong ko lang po, kasi po, minsan po, pag nagwiwiwi po ko, yung wiwi ko, yellowish siya, tapos may mga bubbles. Minsan naman po, para siyang kulay iced tea. Minsan naman yellowish, pero wala siyang bubbles. Pero minsan po, may bubbles siya, pero yung amount ng water na ini-intake ko, same naman amount. Kaya ang tataka ko, bakit minsan po may bubbles? Sign po ba yun na meron akong diferensya sa kidney?
Ang pagkakaroon kasi ng bubble, minsan may pressure ka, di ba? So, malakas ang pag-ihi mo. Pero immediately, nadi-dissipate itong bubble na ito. Pero kapag ka may bubble sa ihi at matagal siyang nandoon, parang ang ibig sabihin nun, baka mamaya may proteins doon sa ihi mo. And protein is a very important finding in kidney diseases. No? It's a manifestation of the involvement of the kidneys in diabetes, in hypertension, or in a primary kidney disease. So, kailangang ma-investigate agad. Yeah. So, kung malaman mong normal, wala palang proteins, masaya tayo.
Okay. Pero doktora, yung minsan yung kulay ng wiwi ko parang iced tea, is that normal?
Ang kulay ng iced tea kasi hindi normal.
Parang amber.
Pwedeng kulay konting yellow, depende sa concentration. Pag uminom ka ng madaming tubig, mapapansin mo medyo clear. Pagka konti lang ang tubig na ininom mo, medyo a little bit yellowish, pero kailangan clear pa din siya. So yung kulay, hindi masyado, which can range from halos wala, parang parang
Tubig.
klaseng tubig to yellowish, pero kailangan very clear siya. Yung tea-colored, yung parang tsaa, is an abnormal color, yes.
Siguro, Doctor, the simple test na magagawa, mag-urinalysis siya.
Urinalysis, oo.
Kasi
Oh,
it's
yes,
a simple
Doctor.
screening.
Napakasimple. Oo, magpa-urinalysis ka na lang muna.
Oh, yes. Thank you, Doktora.
Maraming salamat din for calling.
Magandang gabi po.
Good
Magandang
evening.
gabi.
Okay, good night.
Good night. Doctors, the treatment options available for those who have been diagnosed with kidney disease.
Chronic kidney disease.
Yes, doctor.
So those who go into end stage already, there are two options. So we call it the renal replacement therapy. It's either they go into dialysis. Dalawang klase yan. Sa bata, it's more of the peritoneal dialysis and also hemodialysis. We have a machine that clears off the dirt. Or they go into a more permanent treatment, which is transplantation.
Okay. And same for adults, no, doctor?
Yes, for adults. Pero the kidney failure comes in stages kasi. Stage 1 to stage 5. In stage 5, we call that end-stage kidney disease. But from stage 1 to stage 4, kailangan mabantayan siya ng isang kidney specialist because there are still things that we can do to protect the kidneys. So, hindi naman necessarily pagka nagkaroon ka ng sakit sa kidney, diretso dialysis na yun. Nababantayan, naaalagaan.
Nare-reverse ba yun? Kunyari, you're diagnosed between 1 to 4 and the function of your kidney, nare-reverse ba yan? Will it go back to normal?
Kung chronic kidney disease kasi hindi
na.
talaga. Pero kung halimbawa stage 2 ka, pwedeng mapatagal siya sa stage 2
Yes.
with medicines.
Okay, so medicines, not
Parang yung mga
necessarily
complications
dialysis
yan.
na.
Ma'am, yung mga complications lang na na-expect mo, at least hindi dumating na mas maaga.
Oo. Pero pagka kasi naging stage 3
Ito
ka
na.
or stage 4, predictable na
predicted
yun,
ka yan.
inevitable na yun, papunta na sa dialysis. Nagkakatalo na lang kung kailan.
Okay, but before we reach stage 1 and it progresses to stage 5, there are certain habits that we have to
Yeah,
acquire and there are
yes.
certain things that we have to remember.
Yeah, we must remember that the earlier the kidney disease is diagnosed, mas malaking laban mo. If you come in very late, there's really nothing much you can do. As in anything, di ba?
And with children, doctors, I know sometimes the kids don't really talk that much and express how they feel or kung ano yung nararamdaman nilang sakit. How will the parents
Kasi
handle
sa
that?
amin, like sabi ko nga, yung UTI sa amin, mas graver ang dapat isipin, lalo na pag recurrent, ibig sabihin pabalik-balik. If you have in a year 4 times na nagbabout ng UTI, or in the next 6 months nakakadalawa, then ask the opinion of a doctor and be referred to a nephrologist. Then we'll run tests. Tapos, magpabakuna, importante yan para yung mga tonsillitis o mga infection na pwedeng mangyari muna bago magka-kidney disease, no? Maiwasan natin. Tapos yung nagpipigil ng ihi sa school.
Main cause of UTI,
Sa
it's
school.
common among kids and adults.
Kasi minsan natatakot sila sa teacher, no?
To ask permission para lumabas.
Pero with me, I give them letters that they should be allowed to relieve themselves. At saka, kung medyo mataba kasi ang baby, mga chubby-chubby, minsan masyadong mahinhin kung tayo wiwiwi, it would be better talaga na o-open ng wide kasi may naiiwan din ihi. Nagre-retention sila. And then they have to really move their bowels regularly.
Yes.
Nakakatulong yun para, kasi minsan ang UTI, nare-relate natin doon.
In adults, alam mo, it's common na napipigilan. Mas lalo na with the girls, no? Napipigilan
Yes.
nila yung when they go to the bathroom to urinate.
Yes.
So, nakakakos yun, no?
Sa adults, you cannot really hold your bladder forever. So there will really come a time that if you have normal bladder, then there will come a time na talagang wala ka nang magagawa kundi you relieve yourself. So the problem with holding or retaining the bladder is when you have problems like if you're diabetic, parang you cannot sense anymore the fullness of the bladder. So, kasi meron ng mga problema sa nerves or yung mga lalaki na malalaki ang prostate, no?
Yes.
So, nag-fill up din yung bladder. So, but for normals, you cannot really hold your bladder. You cannot hold your
You mentioned problems, no, that go with UTI. Another problem that we face is the cost of dialysis or kidney transplant.
Yes.
How do we address this? How do we tackle this? How do we deal with it?
You know, the cost of dialysis in the cheapest center, in just dialysis alone, may reach up to about 20,000 a month. And that's only for the dialysis. The medicines will double this price, and so you really have to prepare about 50 a month. So you can just
This is
imagine.
lifelong, no?
It's
Yeah.
a lifelong problem. Buti nga ngayon, PhilHealth covers,
covers that.
covers dialysis. But PhilHealth cannot cover all the dialysis sessions. So we really have to take care of our kidneys. I think that's really the bottom line. We have to take care of our kidneys. If you're since diabetes and hypertension are the two most common causes of kidney failure, we have to address diabetes and hypertension.
Okay. In children, how do we take better care of our children's kidneys?
Yeah, it really goes back to healthy lifestyle.
Yes.
Sabi nga nung aming tagline ngayon sa National Kidney Month, healthy lifestyle makes your kidney smile. So if you do really have good diet, a little bit of exercise, hindi couch potato ang bata, they do not really hold up on the urine. Tapos, yung urinalysis screening test lang, napakadali. Once a year, it will
and
help.
cheap, yes.
It's very cheap.
It's a
And then,
yearly, test that
at
we
least,
should all get.
simple test, no? So makakatulong po talaga sa atin yun. At saka siguro dahil nga maganda na ang information ng kidney disease ngayon, mas maganda siguro talaga we take time na mag-ano tayong PhilHealth kasi yung transplant kayo may coverage na rin at least kung papasa ka doon sa C package na sinasabi nila.
Okay, so thank you very much, Dr. Montemayor and Dr. Valderrama, for helping us understand more about our kidneys, its function, how to take better care of it, and as your tagline goes, how to make our kidneys smile. Maraming salamat. MedTalk will be back. We have more for you. Please stay tuned.
According to the National Kidney and Transplant Institute, one Filipino develops chronic renal failure every hour. This is equivalent to about 120 Filipinos per 1 million people annually.
We're back here on MedTalk, still talking about kidney problems. We've heard about our medical experts talk about the causes, symptoms, and different kinds of kidney diseases. On the average, cases of chronic kidney disease manifest during our 50s, and treatment for these kidney diseases can be very costly. But not all are prepared for this financially. According to research, only 16% of Filipinos are financially prepared to face serious health conditions, such as kidney failure. To those who are not prepared, they have to borrow money, rely on relatives and friends, or sell property to pay for their medical expenses. This could mean more stress and suffering, both for the sick breadwinner and his family. Today, we have with us Film Life financial advisor Larry Cleto to share with us how we can be financially prepared for these serious medical conditions. Hi Larry, welcome to the show.
Hi Angel, good evening, thank you.
Good evening. So as I mentioned, how can we be financially prepared for these medical conditions, in this case a kidney problem, that may occur today or in the future?
Well Angel, definitely we cannot really say when we can get sick. Definitely we cannot stop from getting older.
Yes.
And when we become older, we become more prone to this sickness and more easily gets injured when we meet an accident. But definitely we can do something already as early as today, so that just in case life throws us these health-related challenges, then we are better prepared for it. Now, here in Film Life, we have a new plan that is fit for, or I'd say perfect for breadwinners. We call it Health Invest.
Health Invest.
Yes, Health
Okay.
Invest.
Please tell us about that.
Health Invest provides financial protection. So in the event of a diagnosis of critical illness like kidney failure, as what we have discussed
Yes.
tonight, or let's say accident, or loss of life, they provide financial protection. And the plan at the same time also gives you opportunity to accumulate, build up a health fund that you can use even after working years. So how it works essentially, during the working years of the insured, say you, in the event of diagnosis of a critical illness, or let's say you get injured in an accident, Philip Life will pay you a lump sum. And since this is cash, it's very, very flexible. You can use this cash to pay for your medical expenses that are not normally covered by your HMO. So it complements with your HMO plan, just in case you have one. And well, something nice about this as well is upon diagnosis of critical illness, any unpaid premium will already be considered paid by the company. Philip Life will be the one to continue paying that, and the life insurance remains, and the health fund continues to grow. Now, optimistically, another scenario,
Yes.
let us say the insured is, let's say, was healthy, did not have critical illness, did not meet an accident. There is that health fund and life insurance, and that health fund would have continued to grow, and it has the potential, mind you, to grow even bigger than the face amount, but its growth will depend upon the future performance of the chosen investment fund. So essentially, what you are paying in terms of premiums gets invested, and it also grows.
So even if you've received the cash benefit already, as you've mentioned, you still have a separate health fund.
That's right. So it is very possible, let's say, if the insured gets critically ill, we pay the lump sum cash. He continues to be insured with the original face amount, and the health fund continues because Philip Life is the one who will take over the premium paying part, the one that is unpaid.
Unpaid. Okay, so you mentioned, for example, you don't get sick and
Yes.
you're not able to use that fund.
Yes.
How do you enjoy the benefits of that plan?
Okay, these are going to be a health fund that will grow, and that can be accessible as cash even after the working years of a person when, well, advanced age. Definitely you will
You might need it, no? At some point, you might
definitely-
need it, yes.
Definitely
yes.
you will need more money to maintain your health. That can be redeemed partially or fully, but just in case the insured did not get to use the entire health fund, it will eventually become life insurance that your beneficiaries will receive.
Oh, nice.
And the beneficiaries will receive either the face amount or the remaining health fund, whichever is bigger.
And let's talk of numbers. How much will this cost, or how much
Oh.
is the benefit or the amount that to be given?
Okay, good question, Angel. But that largely depends on the age of the applicant or the person to be insured and the amount that they are applying for, the
Okay.
insurance amount. But regardless of the case, the investment periods are short. So it can be as short as 3 years, it can be 5 years, it can be 7 years. The longest is just 10 years.
Depending on the applicant's
Yes.
preference, so to speak.
Yes, the amount that they chose and of course their attained age.
You mentioned applicants. There's a range, I understand, for the applicants. So what is this age range?
Well, we begin at age 18, and the highest age that we could insure is age 55, but they can be covered up to 65. And the health fund, it can be perpetual for life.
Any other important details that we should learn more about or know more about, Larry, when it comes to being more prepared? No, you can. Filipinos, no, like we've mentioned, sometimes they tend to take it for granted
Yes.
and set aside money for something else. So how
True.
will you encourage
True.
them and help them set aside money for this certain medical need?
Okay, actually, beginning earlier is going to be much easier. There's that tendency for us that, oh, I'll prepare that when
When it happens
when
already.
it happens or when I'm near that. But actually, that's already quite too late. And the amount needed for you to set aside by that time will be significant, such that it's virtually self-defeating that you'd quit upon knowing how much it would be. So it will be best to start early now when it is much more affordable. And when the fund has grown, most of that will come from the investment gain. So much of the fund that you have accumulated is really coming from the investment rather than from your pocket. So I strongly advise that you begin as early as now.
Just like we talk about here on MedTalk, prevention is always key. So in this case,
Always.
it's also key
True.
to be prepared,
True.
to be armed financially,
True.
and to be armed with the information
True.
that one should need,
True.
just in
True.
case there's a medical
True.
concern.
And these benefits will really go even after the working age, when most existing health plans that we have here in the country would have ended. So
Okay.
that will be good.
So in caring for those who need it, you know that it will extend until
Definitely.
your golden years.
Definitely. So everything that you will be investing here, so to speak, walang tapon. So lahat
And-
magagamit.
Okay, walang tapon, walang magagamit. And in arming ourselves with this information, which website do we visit and which numbers do we call?
Oh yes, if you need more information, you can contact a Film Life financial advisor that you would know, or just in case you don't have one yet, you can contact the
You?
hotline.
Can I get in touch with you?
Well,
Yes, your hotline, please.
Right, the hotline of Film Life is 528-2000, or you can visit Film Life's website at www.filmlife.com.
Is there a tagline for Film Life?
It's usap tayo. Anong plano mo? Usap tayo.
Okay, so maraming salamat for talking to me, for talking to all of us.
Oh, maraming salamat too, and it was our privilege.
Thank you.
Thank
So
you.
thank you very much once again, Larry, for sharing with us how we can be financially prepared for life's inevitable health-related setbacks. So again, maraming salamat, Larry.
Oh, you're welcome, and maraming salamat too.
Okay. See you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. I'm Angel Jacob. Good night.